This morning we are going to talk about brachial plexus. My name is Dr. Gakwaya. The audience are learners doing upper limb. The objectives are to produce a doctor who is able to treat clients effectively and safely, pass examinations, to do postgraduate, to be a long life learner. Learner outcomes are to describe the brachial plexus, to recognize its formation, to name its parts, to describe its course, to name its major branches and their distribution, to recognize its relationships, recognize abduction palsy, Crohn's paralysis, and wrist drop. Methods I'm going to use are PowerPoint presentation, illustrations, author's audio. The plan I will follow is introduction, its formation, its parts, its course, its relations, its branches, and the clinical significance. Introduction. The word plexus means a network in Greek. The brachial plexus supplies motor, sensory, and autonomic nerves to the upper limb, shoulder, and part of the chest. The majority of people, it originates from the cervical segment 5, 6, 7, 8, and T1 of the spinal cord. Formation. Fibers come from the dorsal and the ventral nuclei of C5, 6, 7, 8, and T1 of the spinal cord. They are joined by fibers from the sympathetic chain. The spinal nerve is formed. It is motor, sensory, and autonomic. Spinal nerve divides into an anterior and posterior ramus. The posterior rami supply the skin, muscle, and the joints of the back. The anterior rami join in a known order to form the brachial plexus. Slide 1 shows the formation of the brachial plexus. The course. The spinal nerve goes through the intervertebral foramen. It divides into anterior and posterior rami. The anterior unite to form the plexus. The plexus goes through cervical axillary canal between anterior and the medius scalenus muscles above the first rib into the axilla above the subclavian artery. It is efferent and afferent to the chest, shoulder, arm, forearm, and hand. Slide 2A shows the course of the brachial plexus. Formation in more details. This can be illustrated by using your right hand, where you use the thumb and the 4 fingers. 5 roots are equivalent to the thumb plus 4 fingers. And the three trunks are upper, middle, and lower. The upper trunk is formed by the thumb and the index. The middle by the middle finger alone. The lower by the ring finger plus little finger. In the 6 divisions which come from the trunks, each trunk divides into one anterior and one posterior branch. Now, they form cords. There are 3: lateral, posterior, and medial. The lateral cord is formed by the upper anterior division plus the middle anterior division. The posterior cord is made by the upper plus the middle plus the lower posterior divisions. The medial cord is made by the lower anterior division alone. Slide 2B shows roots, trunks, divisions, cords, and branches. During the formation, not all branches have equal number of fibers from the roots. Some have more, others have less. Slide 2C shows again the brachial plexus. Trunks, roots, trunks, divisions, and the cords. The branches. Branches come from roots, trunks, and cords. Divisions do not have branches. So from the roots, we get the long thoracic nerve of a bear. From the trunks, the upper trunk is the one which has branches, and to give the subclavius nerve and the suprascapular nerve. The middle trunk and the lower trunk don't have branches. As mentioned earlier, the divisions do not have branches. The cords have many branches. Lateral cord gives lateral pectoral nerve, musculocuteous nerve, and the lateral head of the median nerve. Posterior cord gives the upper and the lower subscapular nerve, the axillary nerve, the nerve latissimus dorsi, and the radial nerve. The medial cord gives the medial pectoral nerve, the cutaneous nerve of arm, the cutaneous nerve of forearm, and the medial head of the median nerve, and finally the ulnar nerve. To make these branches easier to learn, we use a mnemonic. For the posterior cord, we use ulnar. For the lateral cord, we use Lucy loves me. For the medial cord, we use money makes many men unhappy. Slide 3 shows branches again for emphasis. Slide 5 shows the relationship of the brachial plexus with the axillary artery. Some of the main branches of the brachial plexus. The musculocutaneous nerve. It emerges at the inferior border of the pectoralis minor. It leaves the axilla by piercing the coracoid brachialis near its insertion. It runs in the flexor compartment between brachialis and biceps brachii. It supplies the humerus and the elbow joint. It pierces the deep fascia lateral to biceps brachii to emerge lateral to brachioradialis, and it continues at the lateral cutaneous nerve. It is motor to the anterior compartment of the upper arm. It is sensory to the lateral forearm. Slide 6 shows the musculocutaneous nerve. Slide 7 shows the lateral cutaneous nerve sensory area. The axillary nerve. It goes round the neck of the humerus, goes through the quadrilateral space, divides into 3. Posterior branch, the deltoid and the teres minor, and upper lateral cutaneous nerve of arm. The second branch is the terminal anterior division. Then the third one is the articular, the shoulder joint. Slide 8 shows the axillary nerve. Slide 9 shows the quadrangular space. Slide 10 shows the regimental bulge area around the shoulder. Radial nerve. It starts from the axilla. It is posterior to the axillary artery. It goes through the triangular interval between the long and lateral head of the triceps muscle. It goes through the radial groove through the medial head of the triceps. It is accompanied by profunda brachii artery, which is a branch of the axillary artery. It passes anterior to the lateral epicondyle of the humerus into the hiatal fossa to enter the forearm. It terminates by dividing into 2, the deep motor branch and the superficial sensory branch. It is a motor to the posterior compartment of the arm and the forearm. And it is sensory through 3 branches that are given off in the forearm. Lateral cutaneous nerve of arm, posterior cutaneous nerve of arm, and the posterior cutaneous nerve of forearm. And the 4th branch, which is sensory, is given as its terminal branch, which supplies the dorsum of the lateral 3 fingers. Slide 11 shows the radial nerve course. Slide 12 shows the deep branch radial nerve. Slide 13 shows the radial nerve cutaneous supply. Median nerve. It has 2 heads. Lateral head which is from C5 to 7 and is lateral to the brachial artery. The medial head from C8 to T1, which is medial to the brachial artery. At the cubital fossa, it goes into the anterior compartment of the forearm between the flexor digitorum profundus and the flexor digitorum superficialis. It has the following branches: the anterior interosseous, which supplies the deep muscles; posterior interosseous, which supplies the skin of the lateral part of the palm. It goes through the carpal tunnel and it gives two branches. The current branch, which supplies the thinner muscles, and the palmar digital branch, which supplies the palmar surface and the fingertips of the three lateral digits and the two lateral umbilicals. Slide 14 shows the median nerve. Slide 15 shows the median nerve in the hand. Slide 16 shows the median nerve sensational area in the hand, which is blue. The ulnar nerve. It is a continuation of the medial cord. It is on the medial aspect of the forearm. At the elbow, it passes behind the medial epicondyle of the humerus. It passes between the two heads of the flexor carpi ulnaris. It is motor to intrinsic muscles of the hand, except thinner eminence and two lateral umbilicals. It is motor to the flexor carpi ulnaris. It is motor to the medial half of flexor digitorum profundus. It is essentially the anterior and the posterior medial 1.5 fingers and the palm. Slide 17 shows the ulnar nerve. Slide 18 shows the ulnar nerve supply in the hand. Clinical significance of the brachial plexus. Congenitally, it can be prefixed where C4 takes part, or postfixed where T2 takes part. The acquired conditions, usually due to injury, you can have Duchenne palsy, can have Klumpke's palsy, could have radial nerve palsy, could have ulnar nerve palsy, or median nerve palsy. These will be shown in slides below. 19A shows the policeman's tip, which is A.M.Gakwaya palsy. Slide 19B shows Klumpke's palsy, which is a claw hand. Slide 19C shows a wrist drop. Slide 19D shows ulnar nerve palsy. Slide 19E shows median nerve palsy, which is benediction hand of the Pope. Slide 19F shows radial, ulnar, and median nerve sensation. Ladies and gentlemen, thank you for listening to me.